How we doing there, Trickortrauma? Today I was in the gym and I had a fella come up to me. I've seen him in the gym for a couple weeks now, and he introduced himself and started asking a few questions. Um, First question being how old I was. I told him I just celebrated my 50th birthday recently. Second question was how long have I been working out? I told him that I've worked out on and off in my life for about the last 25, 30 years, but that I'd been injured and I had to stop working out for a while, and I just started back about 2 years ago. And third question inevitably is, hey, are you taking steroids? Because you're 50 years old, and I mean, you say you've been working out for about 2 years, and you actually look like you have a fair bit of muscle. Um, what I explained to him, and the purpose of this video, because there's a lot of misconception out there, is about 2 years ago, um, I went to see a urologist. I had to have a surgery done, and part of the standard blood panel that the urologist pulled before surgery included your testosterone level. And not at the surgery, but at the 2-week follow-up, the doctor stated to me that my testosterone level was extraordinarily low. And when I say extraordinarily low, 400 to 1200 is considered about average, depending on what site you source. My initial testosterone reading on that particular lab was 80, so I was significantly low. And asked me, about lifestyle questions. Was I having trouble, getting an erection or sleeping or anything like that? And I told him, my two main issues that I was having was metabolism. I felt like my metabolism was never good. I never wanted to eat. And then I really didn't sleep all that well. And so he ended up recommending that we do some testosterone replacement therapy, TRT. And so I said, we'll give it a shot. My my impression of testosterone, steroids, was that you get a shot and you go home and you tear up your house, and you're angry at everybody and everything else. And I even left out of that appointment, and I called my wife because he had given me a shot, and I said, hey, if you get home and I'm a raging maniac, this is what happened. They gave me this shot. I don't know what's going to happen. And basically, this was on a Thursday. Thursday I didn't feel any different. Friday I didn't feel any different. My wife crept in the house Thursday after getting home from work and peeked around the corner at me, and I was like, I don't feel anything. Thursday I didn't feel any different. Friday I didn't feel any different. Saturday no different. Sunday morning I woke up and it was rainbows and unicorns. I mean, the world was good. Everything was perfect. I felt like I slept really good. I felt like I had energy. Very, very changing. So Monday morning creeps around, I call the doc. I'm like, hey, if this is the way that you feel, this is the way I want to feel. So consequently, we had to do some other stuff, and ended up getting on testosterone replacement therapy. Well, for me, that was a real game changer. And I'm going to put up two pictures, and these pictures were actually taken exactly 1 year apart, because when I had this surgery, which was a varicocele repair, the doctor told me I couldn't do anything physical until a certain time, and so after my 2-week visit, and he gave me the shot, he said, you can start going to the gym. And again, I haven't been going to the gym for years, but I felt like, hey, I do want to take advantage of being on this testosterone to see if that would help me, because previously in the gym, my experience had been, I worked my ass off and I wasn't getting anywhere. I could go and lift and run and everything else, and I wasn't losing weight and I wasn't gaining muscle. Now, in the meantime, I did see a nutritionist, and the nutritionist gave me some extraordinarily great advice. So maybe I'll make a video about that at some other time. But I got a lot of stuff sorted out in a very short period of time, and ended up just having amazing results, what I consider to be amazing results. Now, all of that being said, my testosterone dose is extraordinarily low in comparison to a lot of other people that I know. And I know a lot of people who are on testosterone replacement therapy. It's not widely spoken about, but I do know a significant, I would say somewhere in the area of 40 to 60 people who are all on TRT. Some of them I actually helped get on the TRT because I recognized some of the signs and symptoms they were having, and I was able to say, hey, why don't you go get this tested and see if this is an issue for you. The one thing I'll say is these two photos are a year apart, to the date, 1 year apart, and a huge difference in your life. So if testosterone replacement therapy is something that as a male can help you, and I'm telling you, like, some of the guys who I've directed to go get tested were as young as their late 20s with low testosterone, and ended up getting on TRT, and it changed their life too. So testosterone replacement therapy shouldn't be a thing that in your mind has some sort of a stigma. Again, my first impression of it was you tear your whole freaking house up and you become a total butthead to everybody, which is not the case. In all actuality, my mood is more stable and more even keel on testosterone than before I started taking testosterone replacement therapy. So, I ended up having a long discussion with this fella at the gym, recommending that he go get tested because of some of the things that he expressed to me that were going on with him. And it became very evident to me that not a lot of people understand what testosterone replacement therapy is, what the benefits of it are, what the long-term benefits of it are, and exactly how it could help the average male. So I decided to make this introductory video. If there's some interest in this, then I'll continue to make some more videos to explain about the nutrition aspect that the advice I was given that I felt worked really well for me. Exactly what the TRT program I'm on is. Some of the other things that I've done to help build muscle and to shed some of the fat that I had, and basic overall health. And I think that's important that especially men who are in their late 30s, 40s, and 50s really start getting interested in their overall health and how to protect that. So, if you guys want to see videos that are first-hand experiences of somebody who's not trying to be Magilla Gorilla and bulk up to be Mr. Olympia, just somebody who's trying to live a decently healthy lifestyle, is completely under the care of a physician. I don't take anything that the doctor doesn't recommend for me. I get my blood drawn every 6 months. If you guys want to see that, then do me a favor, like and subscribe to the channel. And as we get subscribers and as we get likes on the video, it'll be an indication to me of exactly the desire for people to see these videos. And then if you have any questions, comment below, and maybe it's something I'll cover in a future video. All right, so this is Trickortrauma. You guys have a great day. We'll see you around.